Hello, my name is Sonny Achtchi. I'm an interventional cardiologist with Vitruvian Health. I mean, honestly, as early as I can remember wanting to be anything, I wanted to be a physician. And you don't necessarily know everything that entails at that age, but I always liked sciences. I always enjoyed doing sort of manual tasks, which I think is kind of what led me to interventional cardiology. It's always something that I wanted to do, and then along the way, as you learn more about it, you sort of make the decision to continue down that path, which I'm glad I have. So having grown up in Tallahassee, I went to college at Florida State University. So I lived in Tallahassee until I was 23. Moved to South Florida and started medical school at Southeastern University. 2004, stayed there through 2008. And then I did all of my postgraduate training actually at Emory in Atlanta. So I was there from 2008 until 2016, 8 years. So I did 3 years of internal medicine, 1 year of chief residency, 3 years of cardiovascular disease, 1 year as a chief interventional fellow. And then thereafter moved to Jacksonville, Florida, and was in private practice for 3 years before I moved to Atlanta for going on 6. What I always liked about cardiology is that there's a lot of science behind understanding the heart, whether it's physics or electrical engineering or basic biochemistry. It's all sort of there, and it's all been very well defined over the decades. And so we have the ability to take patients from the very beginning of their disease process all the way through the definitive treatment of their process. With all the diagnostic tools and corrective measures at our disposal to do so. So I've always liked that part about it. We treat all manner of cardiovascular disease. So whether it is plumbing issues, coronary disease, whether it's heart muscle diseases, congestive heart failure, whether it's valve diseases, electrical diseases, rhythm problems, pacemaker type issues. If I'm wearing my endovascular interventionalist hat, then we're talking about peripheral arterial blockages, leg pain from inadequate blood flow, leg swelling from inadequate vein function in the legs, varicose veins, blood clots in the legs, blood clots in the lungs. I think one of the most exciting areas of growth has actually been in what we call venous thromboembolism, so more specifically deep vein clots and blood clots in the lungs or pulmonary embolism. Even just in the past 10 years, our ability to treat patients that come in with these life-threatening problems quickly and definitively has grown exponentially. And so there's a lot of really exciting studies coming out that are showing how this is helping people. And we've known from the beginning that doing these interventions instead of just blood thinners and hoping for the best makes people feel better immediately, makes them have better long-term outcomes. So particularly with the cardiovascular service line, it has grown tremendously in the past several years to having capability for heart surgery, vascular surgeries if needed, but then the complete catalog of heart services. And so whether you need a pacemaker or a defibrillator or a stent or work up for chest pain or have a bad valve or a weak heart muscle that needs to be treated with medications, those things are all readily available here now. And we've recruited a lot of really excellent, dedicated physicians that are very knowledgeable in all of these different aspects. And we all know each other very well and work very well together with that common goal of taking care of our patients locally. I mean, the most immediately rewarding part is when somebody comes in, really sick or in danger of dying, and you're able to turn that around and give them and their family that second shot. That's the most immediately rewarding thing we do. But then the patients that you get to know longitudinally, that you help them manage the risk factors that got them there in the first place to the extent that that's possible, and see them do better in life and live a healthier life and have less problems, better quality of life. Those are also very rewarding. The one thing nobody looks at when they walk into your office is the diplomas on your wall. What people value is whether you listen to them, how you treat them, how safe they feel in your care. So I think as a physician, having, first of all, the knowledge to be able to do those things, which is really a requisite to even get into the field, but being able to convey your concern and care for that person and describe their treatment to them in a way that they can understand easily and build that trust, those are probably the most important things.